Myself, Dr. Naresh Gaur, and I am working as interventional cardiologist in Holy Heart Hospital, Rohtak. Next topic that I want to discuss is important, and it is latest update in hypertension. So, as per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to CVD, which affects 45% people in the 40 to 69 age group. Raised blood pressure is among the most important risk factor for CVD. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. Now, in India, the prevalence has also gone up over 30 years to 38% in men and 32% in women, from 29% and 28% respectively. Despite that, nearly half of the people, or around 51% of the men and 41% of women with hypertension, were unaware of the condition. Additionally, over 62% of the men and more than 53% of the women living with hypertension did not get treatment. So, medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women, that is around 20 to 25% of the population with hypertension worldwide, and this data is published in Lancet in 2021. That is latest data. International Society of Hypertension has released the ISH 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigm attempts to address the issues that in resource-poor settings, optimal care refers to evidence-based standard of care, and whereas essential standard refers to minimum standard of care to allow specification of essential standard of care for low resource settings. As per American Heart AHA guidelines, American Heart Association guidelines, they released that its scientific statement in 2021 offering new guidance for management of stage 1 hypertension among patients with low ACVD risk. Among low risk adults, that is no ACVD or 10-year CVD risk less than 10%, with stage 1 hypertension, that is blood pressure 130 to 139 systolic and 80 to 89 mmHg diastolic. The management starts with non-pharmacological therapy. And if blood pressure remains uncontrolled at 3 to 6 months, then we should consider for starting pharmacological therapy as per the guidelines. Acute respiratory distress syndrome, that is ARDS, is a potentially fatal condition involving lung damage, and experts often associated it with severe COVID-19. A recent study which appears in the Journal of American College of Cardiology reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 induced ARDS. Lowering systolic blood pressure targets down to 110 to less than 130 mmHg range substantially reduce CV adverse events in the STEP randomized trial, affirming the sprint finding for one older Chinese population. Among some around 8,500 patients aged 60 to 18 China, the intensive target trimmed 26% of the composite CV risk. Finding from now a second major trial supporting a lower target could unite the guidance, which even among US professional societies range from threshold of 130 to 150 millimeter Hg. With regards to prognostic value of ambulatory BP monitoring and nighttime blood pressure, the 2018 European Guidelines on the Management of Arterial Hypertension recommend that diagnosis of hypertension should not only be dependent on office blood pressure measurements but also on out of office measurements such as ABPM or home blood pressure management, that is HBPM. 24-hour and nighttime blood pressure measurements were associated with greater risk of mortality and a composite of CV outcomes. Thus, they may be considered as the most relevant measurements for estimating CV risk. For every 20 or 10 mmHg increment of blood pressure, that is systolic and diastolic respectively, measured at night, the risk of mortality increased by 23% and the risk of cardiovascular events by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal blood pressure control. The 2018 European guidelines equally recommend five classes of antihypertensive drugs. Considering high non-adherence treatment, the importance of combination treatment is particularly highlighted to improve adherence to therapy and blood pressure control. Therefore, the 2018 European guidelines recommend, especially in the context of lower blood pressure targets, to start antihypertensive therapy with an initial dual fixed combination of ACE inhibitor or ARB plus calcium channel blocker or diuretic. Since early July 2018, Product containing valsartan have been recalled worldwide. The reason is the detection of a known carcinogen, namely N-nitrosodimethylamine, which can be found in candesartan, irbesartan, losartan, olmesartan, and valsartan. NDMA has been classified by WHO, International Agency for Research on Cancer, to be carcinogenic in humans. If 1 lakh patients would have received NDMA containing valsartan from Zhejiang manufacturing site where the highest level of containing were found, every day for 6 years in the highest dose, it could result in 22 additional liver cancers over the lifetime of these patients. The presence of NDMA in these drugs could lead to 8 additional cancer cases in 1 lakh patients if they had taken the highest daily dose over 4 years. The Sartan recall accompanied by a significant increase in the rate of emergency department visits by increment of 6%. Higher study represents the largest study that tested nighttime antihypertensive treatment, and in this trial, chronotherapy was associated with a significant reduction in endpoints, including deaths. And the Hygia chronotherapy trial tested whether nighttime therapy in comparison to usual upon awakening hypertension therapy exerts a favorable CV risk reduction. The largest study included a total of around 19,000 hypertensive patients. During an average follow-up of 6 years, around 1,700 participants experienced the primary CV outcome, and ambulatory BP monitoring was performed for around 48 hours to collect data on how blood pressure differed during sleep. RR reduction for CV events was significantly improved for nighttime treatment when compared with awakening treatment. These are some latest guidelines and latest studies that have been conducted in management of hypertension that should be followed by each physician as well as cardiologist. Thank you.